You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, and it's a special edition today, we're talking about rhinoplasty, what you need to know if you or a loved one is considering any type of rhinoplasty, facial plastic surgery, or chin implants. In fact, here's a sample of Dr. Greco's work. What many people don't know is that rhinoplasty, according to plastic surgeons, facial plastic surgeons, is one of the most technically demanding, artistic things that they do. And some people even say you have to get it right the first time. Well, with us, we have Philadelphia's go-to facial plastic surgeon and go-to rhinoplasty, Dr. Greco. Dr. Greco, welcome to the program.
Pleasure to be back, Randy.
I should say welcome back. You know, we were in the green room, and you're showing me photo after photo after photo, and I want people to know I'm not siding with you or endorsing you on this program, but I told you, these are some, and I've had a lot of plastic surgeons on the show, and they may not like that I'm saying this, but these are some of the best, if not the best, rhinoplasties I've ever seen. It's very nice.
I appreciate that.
And these are all on your website?
They are.
Because we probably won't be able to get to all of them. I know you brought a stack of them, and I hope they stay around to look at those. But for people that don't know you, you're a board-certified facial plastic surgeon, board-certified in ENT or otolaryngology. So who do you see? All you do is faces. Who's your typical patient?
Typical patient, Randy, is at the younger age group, it's patients that don't like their nose or they don't like their chin. The features of the nose that patients don't like are the bridge being too high or having a hump. They don't like their nose. The tip of their nose in particular doesn't have definition that they like it to be. Some feel that their nostrils flare too much. Some of it may have been in an accident and they have a crooked nose now, and that bothers them aesthetically as well as functionally. Chin implants are also very popular in this age group because many times patients don't realize it, but when they come in for the consultation, they're looking at their nose. But when I take a profile picture of them and we start doing the video imaging on them, they start looking at their chin and they see the improvement that can occur from, augmenting the chin. Okay. As we go a little bit further up the scale, aging scale, we start getting into patients that are more interested in some of the minimally invasive procedures. The fillers to help fill out lines. We do a lot of volume now with minimally invasive procedures. Instead of chasing lines, we're now looking at putting volume into the face, which really helps to restore the volume that's being lost as the face ages. Okay. And then, when we start getting in the 50s and 60s, we start getting into patients that really aren't going to benefit from the volume because of the skin envelope just is, unfortunately, has aged. It's lost its elasticity, and therefore there are procedures necessary to tighten that skin envelope.
Now, at the top of the show, we said you're the go-to facial plastic surgeon. You are known in Philadelphia for the natural-looking facelift as well. I mean, we've had you on the program before talking about that.
One of the things I love to hear from my patients, Randy, is when we see them after surgery is over with, and I have their before and after pictures on the video imager, and they're looking and they got that smile in their eye. Every once in a while, you might see that little collection of tear in the corner of the eye, or the significant other is just smiling and really, feeling good for their partner. They see the difference and it's dramatic. Yet they tell me that their friends don't recognize that they had actually any surgery done.
So you could do a facelift and nobody would know, possibly?
Yes.
Really?
Absolutely. And what they do is some people are very, 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 they're very keen to that stuff. But a lot of my patients' friends just look at them and say, you really look good, or you just don't seem to age. You just really, really look good. And my job is to, make them have a youthful, fresher, rested look, and make sure that the incisions and everything like that heal very well, so these patients can, look good without looking like they've had something.
So let's start with the nose. Okay, so rhinoplasty, and I know you brought a lot of photos.
Sure.
So tell me what So this represents like typical patients you see all the time.
Sure.
Okay.
Sure. So I want to show you this patient here. Okay. This patient here is our first case, Randy, and what it does is it shows that this patient is not pleased with the general shape of her nose. She had surgery done before. And the thing that's bothering her the most are several things. So for this particular patient, what she's concerned about is she has this hanging columella, or the bottom portion of the tip of the nose is hanging down too much. Okay. And this is going to only get worse.
And that bothered her?
It did. It did.
Okay.
And she also noticed that over the last several years, this was a progressive thing. So she was seeing it getting worse and worse and worse. Okay. Now with that was the bridge of her nose. The bridge of her nose is kind of deviated to one side, as you can see. Okay. And this was associated with a breathing problem. Okay. Now, I want to show you something. This is the after picture. Mm-hmm. And what I want you to do is, before you look at the nose, I want you to take a look at the eyes of the patient before and after, and tell me if you think that there is more of an expression to the eyes afterwards.
Yeah, that's a good point.
Okay, so there's an old saying in our business, Randy, that I see all the time.
Yeah.
A good rhinoplasty is found in the eyes of the patient.
Really?
You know, just by making the nose more proportional with the rest of the face, the eyes become more prominent, and the beauty of the eyes become more prominent. The expression that the patient possesses probably is a reflection of some inner confidence, inner beauty that they feel. But a good rhinoplasty is found in the eyes of the patient.
So in her before, a little bit tilting to her right.
Yep.
That little tip here was falling,
Yep.
so you just kind of picked that up.
Yep.
Redid that.
Can you see that on the?
Yeah, it is. It's subtle.
Yep.
But it's good.
But also you can see that the nose is straight, correct?
Yes.
And now she has a very good airway also. And this is
so she can breathe out of it as well.
Exactly.
Okay.
Now let me show you the profile to this patient.
All right.
Even though I like the front view, but the profile is really unique. Okay. So this is the before patient. All right. And what you're seeing here is what happens with a lot of rhinoplasties that have been done. As time goes on, the tip of the nose becomes amorphous and a little bit bulbous. It kind of looks like it just doesn't have that refinement, okay? Now, this is her afterwards. Now, when you take a look at it, their before and after picture, you can see now that she has a delicate tip to her nose. You can see that that portion that was hanging down in front is now providing for what we call a double break, okay? Usually on profile with rhinoplasty, Randy, you'd like to see the patient have a little bit of a double break in this region. And what that does is it sets the nasal tip off that much more beautifully. Okay. And I think you can see that we were able to obtain that with this patient. The other thing was too, is she wanted to have a bridge of her nose that was a little less masculine, and I think we were able to also provide that for her too. This is a 3/4 view, okay? And it's a very important view in rhinoplasty, and I'll tell you why, Randy, because what it does is...
You can really see that tip in this photo.
Yes. Yes.
The tip is...
Not only that, but not only can you see the tip, but you can see the position of the tip. You can see that we rotated it up a little bit.
So subtle.
Yeah, but that, you know, our game is a game of millimeters, you know? That's why when my plastic surgery colleagues, when they're working on breasts and they're working on liposuction, they're looking at it in inches. My whole life is all about millimeters.
I have to mention this because the plastic surgeons that I meet, facial plastic surgeons I meet, some of them don't like doing rhinoplasty. Yeah. Like they say it's one of the most difficult things, but you love it. It's the funnest surgery that I do. And I'll tell you why, Randy, because each one is different. You know, my rhinoplasties are not cookie cutter. Is it true you almost have to get it right the first time?
You try to do the best you can.
Okay.
You know, but I mean, really, you know, when you're doing a good rhinoplasty, you really want to have a good diagnostic plan. You should be able to look at a patient's pictures, and after examining the inside of their nose as well as the outside of their nose, you should be able to come up with a picture in your mind of the architecture of this nose and how it needs to be changed in order to get the result that we want.
But that comes from a lot of experience. I mean, you've done over 1,000 of these.
It's one of those things that you're right. I mean, but I will say this: every rhinoplasty that I do, I learn a little something new every time I do one. And it's you know, I never want to stop learning that. I always want to pick up on things, the new ones. Okay, here's a patient. She comes in. Now, this would be a bulbous tip, okay? And you can see her after, and you can see how, so if you look at the before and after, you can see that, you know, this was, that we were able to reshape the tip of her nose. Now, this bulbous tip, Randy, I'm gonna get a little technical on you here if you don't mind, okay? The cartilages to the nose, particularly the lower lateral cartilages, when a patient has a nice refined tip, the cartilages tend to go out this way. Okay. And they point to the lateral canthus. When patients have a bulbous nose to begin with, instead of this cartilage pointing here, it points up to the medial canthus. By doing that, it causes this ball look. Now, here's her before picture on the profile, and then here's her after.
Oh yeah, had a little bit of a hump on the ridge of the nose.
But look at the definition in the tip.
Yeah, the tip is different. Yeah, it's nice.
But it's because we were able to remove those cartilages. If somebody wants to have a nice refined tip, those cartilages have to be in the right position. What we did is we put them in the right position. 3/4 view I really, really like, because in this particular patient, what you're seeing when on the before, right? You're seeing a dorsal hump, and you're seeing that ball to the nose.
So the bulbous nose. And it doesn't look like a nose job.
It doesn't. That's the
I'm
key.
not trying to side with you, but
That's the key.
Going into this today, because I knew we were talking about rhinoplasty, and I always know what a nose job looks like. You said, not mine.
Yeah,
it's good.
I tell patients what we're going to do is we're going to give you a nose that's going to make you look better, feel better, function better. But, you know, like the one commercial used to say, did she or didn't she? Or, So that's kind of what we are for. Now, this gentleman here, you know, trauma after he had an injury to his nose.
Yeah, totally different.
And then here is his front view.
Now we should mention, you know, in the green room, you handed me papers to read, and people that you fixed their nose, for some people, it was life-changing.
Yeah.
And at first I'm thinking, well, I don't know if I have to read this, but then, you know, these people are bleeding their guts, their heart. And one woman in the front seat of a car, she said that on a date, she was worried that her date was going to see her profile.
Yes.
So these people that come in, usually their noses bothered them for many years before they get to you.
Yep.
Is that right?
Yes, absolutely, Randy. And you know, one of the most common things I hear, and we also discussed this earlier, was for patients that actually are going in, they're going out to get some clothes, and they go into that situation where, you know, they got that the 3/4 mirror. You know what I mean?
Yeah, the clothing.
The clothing mirror, right? That allows them to see it. Well, on that 3/4 mirror, when they look to their right, they can see their profile because of the double reflection. And a lot of times, you know, it's funny. I hear a lot of patients say they just step away and they keep on moving back until the only thing they're looking at is the front view, and that's it. You know what I mean? So one woman wrote me a letter one time. She goes, "Thank you for allowing me to rediscover the 3/4 mirror again," because she can now look at her profile and and see what she wanted.
Okay,
so
good.
Another patient here with a dorsal hump, and I thought she had a pretty nice result. And then if you look at her befores here, you can see this nose was kind of a long, thin nose, and I think we just gave her a little bit more balance. This patient, Randy, is one of the classic patients that I'll see in my practice. This patient was graduating from high school and going into college. He was getting into a new social set. He had, you know, lived with his nose during high school, and he was going off to college, and he was going to do something, give him a little bit more confidence, a little bit more self-esteem, and not have people say, you know, well, you know, because usually a large dorsal hump, people will say, something's, a little bit different.
So he didn't like that hump, the bump on his nose.
Exactly. But this is after. And once again, I mean,
wow.
That's just it's just a nice natural nose. This is actually him 4 years later. So this is a 4-year follow-up.
It's very interesting.
Okay. Here he is on his front view, and you can see the long, thin nose. But now he's got a nose that kind of has a little bit, nicer flow to it. You don't see the dorsal hump. The nasal tip is a little bit more, in line with the rest of the nose.
When we look at the before, because we talked in the green room, like it's like having the big nose for this guy bothered him.
Yes.
He feels, you say, like other people are looking at him, and they may not be.
Yes.
But if it bothers you, do something about it.
Yes, absolutely. And this guy's a good-looking guy. I think he's a good-looking guy.
Yeah.
You know what I mean? And it's amazing how that comes through. You know what I mean? I mean, if you look good, you feel good, and vice versa. So I think this is where rhinoplasty really comes in. Now, this is something I see a lot in my practice.
All right.
Deviated nose, wide dorsum. Okay.
Okay. Just
All
a
right. wide thing. So this is her after.
Very nice.
Okay, so you can see that she's the symmetry has been provided. This was her profile, and then she just wanted just a tad bit of a little bit of a set off, right?
Yeah.
But you see what you're seeing here? What you're seeing here, rhinoplasty after rhinoplasty after rhinoplasty, is me trying to highlight the best features of the patient's face and not causing attention to the structure that was actually operated on. That, to me, Randy, is the key to a good facial plastic surgeon. I can make a change in a face and the whole face looks better.
Is rhinoplasty more art or science?
That's one of the reasons why I love this procedure so much, Randy, is because it's both. It's both. You have to understand, particularly it's science when it comes to function. You have to understand that there's an internal nasal valve, there's an external nasal valve, there's the septal component to the breathing, other things like that. And then the art comes into what you do to try and show the, have the before and after.
Okay.
Take a look at this gentleman here. Kind of a long protruding nose, okay? Now what you see in this nose here, Randy, is two things. Number one, on the before picture, not only do you see an over-projecting nose, that nasal tip is over-projecting, but he also has a low dorsal hump, okay? Now, what I did for him also was, I did a very small chin implant in him because I didn't want to have to take his nose down too much and change the profile, profilometry of his face. So what we did was we did a rhinoplasty, which you can see the difference there, and just a slight bit of a chin implant to just try and give him a little bit of strength to his chin.
So he goes from a guy that probably everybody identified him as the guy with the nose.
Right.
To now it just kind of blends into his face. And their
That's
whole life can change. For some people, you say that this is like a new beginning.
This meant a lot to this gentleman. This meant a lot to him. He's a good looking guy, really nice guy, a complete gentleman. And it's neat to see this sort of, that transformation. This is one of my favorite patients. He's a great guy. He used to play baseball in college, and we got along so well because the first thing we started doing during the consultation is talking about baseball. Do me a favor, take a look at the bridge of the nose.
Okay, so right there.
Yeah. Do you see how it's making a left-hand turn?
Like it looked like it was broken or something.
Yeah, exactly. So this is something that bothered him very much. And so this is his after picture. You can see where you're able to line him up better and get him to look better on the front view. This is his profile view, okay? So what I did was we gave him a little bit of a chin implant and did a little bit of submental liposuction to just give him a little bit of a cleaner jaw, and then it kind of blended subtly but nicely with his nose.
Nice.
All right? Now, this woman, another patient that is near and dear to my heart, comes to me. she wrote one of the letters that I had showed you. This is what we did for her afterwards. You can see,
goodness.
You can see the before and after there is just, remarkable.
I mean, it really does change her appearance.
Yeah, she's not only a more confident woman, she's a more attractive woman right now. And it's
this is the gal that she said this is the letter
right.
This is the girl attached to that letter.
Yeah.
Even driving in a car on a date,
right.
She didn't want to sit side by side because they might see her profile.
Yeah, right.
Interesting.
And now she's just, she comes in and you can, first of all, there's a certain bounce in their step, Randy, which is really cool.
After it's all done.
And then there's this, before, in the initial consultation, it's almost like you had to drag the smile out of them. Now they just volunteer the smile. All right, take a look at this gentleman. Another really super, super nice guy. Okay,
that's an unusual nose right there.
This is a revision, okay? Take a look at the 3/4 view. It looks like he's just and then take a look at his profile view where the nose is just,
Okay.
So, okay.
And it really bugged this guy.
Oh, and not only that, this guy's an athlete, and each week that was going by, he was having much more difficulty with running and getting air.
He couldn't breathe through his nose very well.
And it got worse and worse and worse. So take a look at his front view that you have there.
Oh my goodness. Totally different.
Amazing, isn't it?
I mean, he's a handsome guy, but obviously this adds to the attractiveness.
No question about it. No question about it. And he's in a very, here's a 3/4 view. Take a look at the 3/4 view.
Whoa. Guy's got to be happy about that.
Yeah. Profile. And then the last one will be the tip, the nasal tip. This is another revision rhinoplasty, okay?
So that means that they got a nasal rhinoplasty nose job somewhere else?
That's correct.
Okay.
Okay. She came to me because she didn't like her tip, okay? And the other thing she didn't like was, on profile, she just felt that her nasal tip was a little bit bulbous. There wasn't definition to it. Here's her after view. If you notice, these indentations here are no longer there.
Oh yeah. So it's a little squeezed at the tip.
You see, the pinched look is gone. Do you see it?
Yeah.
Now look at her profile. Now see how we were able to give her a little bit of definition to the tip of the nose, and that was just through what we call a shield graft, which is a graft of cartilage that I placed here. And what that did is it just gave her, if you look at the before and after, you can see that looks a little bit wider at the tip, but here it looks more refined.
Now, we are really short on time. A couple of minutes left. The chin.
Yes.
You brought some photos of the chin, and you say they go together, rhinoplasty and chin.
Absolutely, Randy. What we're talking about is profilometry, or the profile aspect of the face, okay? So Leonardo da Vinci divided the face up into thirds, the forehead, and then from the glabella to the subnasale or nasolabial angle, and then from the nasolabial angle to the bottom of the chin. They should be equal, okay? Sometimes when patients come in and they have a large nose, there is an associated weakness in the chin.
So if the chin's too far back, the nose appears to be bigger.
There's an inverse relationship, right?
Okay.
So if I bring the nose back, the chin looks like it's projecting more. If I take the chin back, the nose looks like it's projecting more.
All right.
Okay. So let's go with this patient here first. I think she's a remarkable result. This was another letter that you had read that where there's.
Is this called a weak chin? Is that what that is?
Yes.
Okay.
Weak chin or retrognathia. Okay, which is usually associated with
only you guys call it that,
which
right?
is associated with a class 2 occlusion. It usually means they have a overbite. Okay. Now this is this patient, and you read one of her letters, and she was a patient who just she had mentioned, I think, something about Kermit the Frog.
Somebody called her Kermit the Frog because she had no chin.
Because she had no chin.
Terrible.
Now you can see her after.
Wow.
And this is pretty remarkable.
Just with the chin.
Yeah. Now, take a look at her lips, though. Look at this is what I call collateral improvement, where you can do a chin augmentation, and that's all you do. But look at her cervicomental angle. Right here? Doesn't that look a little sharper?
Yeah, her neck looks more chiseled.
Yeah,
was that lipo?
No.
Just
that was just
by the implant.
Yes.
Now that other view.
Take a look.
I mean, that's
You can see
amazing.
Yeah. Now you really see the benefit of what that looks like. Okay? So, this gentleman, you can see, comes in, has an extremely weak chin, and has a submental adiposity. So
What does that mean?
So it just has fat underneath her chin.
Okay.
So, you know, and unfortunately, the fat underneath the chin is genetically determined, and it's also fat, Randy, that is difficult to remove with diet and exercise. So here's your before and after here. Gave him a nice chin.
Wow.
Gave him a nice chin implant. Okay. Give him that strong anterior projection, and then the submental liposuction. And now, I mean, the guy looks like a handsome guy now. I mean, I think it really helped to improve his profile nicely.
Yeah.
All right. Last one I'll show you is a sweet woman that came to me who just never, ever liked her chin. She thought her lips were too large for her face. And what we did is we gave her a chin implant. And that's the only thing we did. Now,
it's like her face has been pulled in, almost,
exactly,
on the profile.
Exactly, but take a look at the proportion of the rest of the structures of her face in relation to what she had before and what she had after. This is what I mean by collateral, a positive collateral effect.
So that means you did this and it affected other parts of the face.
Exactly.
Interesting.
And that's what's neat about
So
this stuff.
chin combined with rhinoplasty.
A very strong combination that can give patients a sense of self-confidence, no matter which angle they're being looked at, no matter what mirror they're being seen in.
Because that's the party shot. I mean, when you're at a party, everybody's looking at you from the profile.
That's what it is.
I think you called it the party shot.
Yeah, you're right.
So when you fix that,
yeah,
it does. It completely changes. So they're thrilled. When it's all done, they just...
it's a real, you can really make a dramatic change in a patient's appearance and in their psyche.
What's the downtime? I mean, if everything goes great, how soon could you return to work, like with a chin?
10 days, with a chin, probably about 7 days.
So like take a week off?
Yeah.
But some people go back to work earlier.
They do. They do. You know, I always ask patients, Randy, if they have a behind-the-scenes job, they can get back as soon as they want.
Okay. Great stuff. All this is on your website. I want to thank you for coming on the show.
It's always a pleasure.
So
Randy.
final message, if you don't like your chin, weak chin, your nose, come in for a consultation.
Absolutely.
And you're going to show them imaging
We're
in
gonna show 'em
advance what it's going to look
imaging.
like.
And let me tell you something. Video imaging, particularly when it comes to the profile of a patient's face, is so helpful to the patient to get a good appreciation for what they'll look like. And a lot of times we might even end up doing a little liposuction.
On the neck. All right. I want to thank you for coming on the show. Great stuff.
Great. Appreciate you having me here.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.